All right, I will be doing an assessment on a newborn baby. I'm going to make sure my area, of course, is nice and quiet and warm for the baby, the newborn. During your newborn assessment, soon after delivery, they do what they call as a APGAR scoring, where they check the heart rate, the respiratory rate, the muscle tone, reflex, and color, each receiving 2 points. The range normal is from 7 to 10, and that will show how good the baby is handling the outside environment after being delivered. So now to do my physical assessment, I'm going to just unclothe the baby from the top part so we can do the assessment at the top, take off the hat. I'm going to first look at the general appearance of the baby, make sure the color is fine. I can do the little on the nose and on the chest to check for blanching, and the baby is actively moving, so muscle tone is seen, and the symmetry of the baby. The hands, if they're a little blue, that's called acrocyanosis, which is normal. All right, so then the next thing I'm going to do is I'm going to check the head for symmetry. Sometimes during delivery, the baby head might look a little coned, which is they call molding coming out of the vaginal birth canal. Make sure there's no hematoma and it's nice and soft and flat. The fontanelles, the top one is soft, a diamond shaped, and in the back you have the posterior, which is like a triangular shape. Make sure it's soft and nice. Sometimes if it's sunken in, it could mean the baby's dehydrated or maybe something else is going on, so we have to investigate further. Now we're going to check the nose, make sure there's no flaring going on, because that represents respiratory distress. And now we go to the mouth. We can, with a glove finger, put the finger inside and see if the baby has the sucking reflex, and then you check the hard and the soft palate with the soft part of your finger at the top, and good. Then after that you open to make sure it's pink and moist inside. Also, the rooting reflex is done where you put your finger to the side and rub the cheek, and if the baby turns, that means, you know, they're responding to like a bottle or a nipple that's coming in the mouth, so that's a good thing. I'm going to now check the eyes, and the pupils are good, the sclera is fine. Make sure they're symmetrical, and if the baby follows the hand, okay, see if they're seeing. Then we're going to do the ears, and we're checking to see if they're symmetrical and they're even up with the outer corner of the eyes, and they are. If you bend it and they recoil quickly, that means they have good reflex on both. Very good. Now we're going to check the neck, make sure it's strong enough to hold up the head and support the head. We're also now going to check the chest part. We start with the clavicle, make sure it's nice and flat. There's no bump or ridges, because sometimes during delivery that can get a little crashed or fracture or dislocation, and that's fine, there's none. We're looking at the chest, make sure it's even and symmetrical as well. We will be listening for the heart and respirations, and the normal heart rate is from 120 to 160 for the infant newborn, and then the respiration is from 30 to 60, and we will listen to that like we would do right there, and then check right there, a minute in each there. Okay, right there. The last thing we will do is check the temperature, and we'll be on the axilla. We'll do this last so it doesn't make, you know, the baby kind of uncomfortable with this going under their arm. And then the temperature is normal, 97 to 99.5, and that's fine. Now we're going to check the arms, make sure they're symmetrical, and of course we're seeing good muscle tone, because the baby usually keeps their arms kind of together with their fingers in a fist form. To check for grasping, you're going to put your finger there, and the baby's finger should curl around your finger, and it does. Very good. And now that we're finished, we're going to go ahead and go down lower, but you can also check the brachial pulse at the same time, make sure they're symmetrical, and yes, I feel it, it's good. And for the moral reflex, to see if the baby startles, you can clap, and this will also see if the baby's also hearing, and you can pull the baby up just a little with the hands and then let go real quick both sides, and then the baby usually jumps. That means they have a good startle reflex. Okay, now We'll go down to the bottom. We're looking at the abdomen. Make sure it's also symmetrical, and the umbilical cord, it's clamped off. Make sure there's no bleeding or no infection noted. You're going to listen for the abdominal sounds as well, and in all 4 quadrants each minute. You're going to go the same way like you would do an adult and listen. Good. And then you also will palpate the abdomen. Make sure there's no tenderness or any mass. And how you'd find out if it's tender, the baby will either like pull away or the face would grimace. Alrighty, and now we're going to look at the genitalia for the boys. Make sure the scrotum is nice and even and symmetrical. You'll see rugae on the scrotum, and no abnormality noticed on the penis as well. Hypospadias, which is a little hole at the bottom, or epispadias is at the top. For the female, you'll notice the genitalia is swollen, and usually sometimes they'll have a little discharge, which is called the pseudomenses, and it's all due to the hormones during pregnancy. All right, we're going to just cover there. We're going to check the legs, make sure they're nice and equal. We're going to check for the hip, make sure there's no dislocation, and it's done with the Orlanis and the Barlows. You go up and in and curve out, and then you go this way and curve in. Good. Didn't hear any clicking or anything like that. Now we check the feet, make sure they have they'll have creases on there. You could do the Babinski reflex, which is you got your finger from the heel all the way up, and the toe should flare out, and that's a normal sign that we want to see on both sides. Very good. Now we're going to turn the baby over. If you had not listened to the lungs, you can listen to them now as well. From the back, we're going to check the spine, make sure it's nice and even in the vertebrae. It's flat and nice. At the sacrum, you might sight some dimples or some little hairs, and that's fine. Make sure the anus is patent, and if they had their first stool, the meconium, then that's fine. You're going to check the creases, lay the baby down, turn the head to the side. The creases are nice and even on the legs, and they are very good. And you can now turn the baby over, and you can check the walk reflexes. You see if they're trying to walk when you stand them up, they usually step their foot there. And that will conclude our newborn assessment. Now you cover up the baby, keep her nice and warm. Thank you.